All right, we're here with another workshop. We have Blake Lancaster, the owner of Make a Play Training in Huntsville, Alabama. He's here to lead this info session on ACL injuries and return to sport. Blake, take it away.
Yeah, well, today I just want to kind of come in and talk a little bit about ACL injuries and then more probably along the rehab aspect. If you or someone you know has suffered an injury like this or looking to kind of give you some information on re-injury rates and things like that, it's not meant to be a like fear-mongering session, but you do need to know what you are faced with in the next year and a half, 2 years, because it is a lot longer process than a lot of people realize. The biggest three things I want to talk about are going to be that re-injuries are prevalent within ACL injuries. After you have an injury, your rate of having another injury increases a lot. And we're going to talk about exactly how much and what are the reasons, things like that. Another thing we're going to talk about is successful rehab is a must. You have to put in the work, put in the time, put in the effort to get back to your sport to play at a high level. Most people do return to sport and return to sport at the same or better level, but a lot of people don't because they did not necessarily do all the things that they were supposed to do during the rehab process. And the last thing we're going to talk about is the reintegration back into sport must be gradual and it needs to be looked at holistically from all aspects of the rehab protocol. So from the doctors, from physical therapists, from athletic trainers, from sport coaches to strength conditioning coaches, everyone needs to be involved and kind of have their say in it and have a little bit of input to discuss what is the best strategy to reintegrate the athlete back into the sport. All right. So first thing up is going to be that re-injury rates within ACL tears are prevalent. We have a couple different stats on this from a couple different studies. The rates of ACL reconstruction has risen by 22% from 2002 to 2014. That's kind of one of the last studies that they've kind of looked at of increasing rising rates. It's a little bit older, but the trends have continued moving forward, probably even more so than even back then, just based on a lot of different things. We're not going to get into talking about club sports and year-round playing and things like that, but there's a lot of different factors leading to this kind of increase in rate of initial injury rate. Paterno et al. In 2014 found that 30% of youth athletes who return to sport will sustain a second ACL injury within 2 years. Okay, so 30% of youth athletes who tore their ACL originally will have a re-tear within 2 years. That's 1/3 of athletes who get hurt. That's a lot bigger number than I would like to see. It's probably not necessary. Females are 2 to 8 times more likely to sustain an ACL injury than males, and that was found by Hillebrand et al. In 2018. All the information they looked at. So same thing is not meant to be fear mongering, but if you are a female athlete, you do need to know that you're at more risk and you need to take some time and actually focus on more the prevention side of that. You need to take a step forward and do what you need to do on the front end so you don't have to put in more work on the back end to try and recover from the injury. In 2019, Wester et al. Found that only 23% of the athletes they looked at passed return to sport criteria. All these studies have different return to sport criteria, whether they be a strength test. HOP test is usually around 6 different exercises or 6 different tests that may be exercises or maybe some sort of mental worksheet to see where they're at mentally on returning to sport. We're not going to go into directly what they did, but what they found is only 23% of the people they looked at passed those tests, which is crazy. That means that within there, 77% of the people who tore their ACL returned to sport when they weren't ready. So these criteria are things that doctors and scientists have discovered that, hey, we need to kind of check these boxes to do our best in saying, hey, we are ready to return to sport. And we're not going to get we're going to reduce the likelihood of re-injury if we cross-check these boxes before we return to sport. And only 23% of the people they looked at actually check those boxes before returning to sport, which is kind of terrifying, honestly. If my kid did not check these boxes and were sent back to sport by their doctor, physical therapist, whatever, I would be honestly pretty upset knowing that there's information out there saying that this could increase their chances of re-injury. So within that, the same group, Webster et al. In 2019 found that of the 23% who did pass their return to sport criteria, 235% increase in risk of contralateral tear, so the opposite limb. So of the 23% of people who passed it, they were more likely to re-tear or tear their opposite limb as opposed to the same limb. And within that's a whole can of worms we can look at, but probably something to do with spending a lot of extra time on repaired leg as opposed to unrepaired leg. But that's, anecdotal, and that's probably speculation. We don't need to go into that. But it does say a lot about the risk of re-tears and contralateral tears. So there's a lot going on here within the I've torn my ACL and now I'm going to try to return to sport and try to do it safely and effectively. We got a lot of things we need to look at and think about. In 2016, Grindam et al. Looked at 100 ACL rehab athletes, and their median time of return to sport was 8 months. Okay, so for the athletes who did return to sport sooner than 9 months, 9 months is kind of the mark they decided after looking at all the data was kind of the sweet spot for all their numbers. If they returned to sport less than 9 months, they had a 39% chance of re-injury rate. If for those who return to sport after 9 months, at 9 months or after, they only had a 19% chance of re-injury. So for essentially what they kind of ran the numbers, and for every month delay in return to sport after 6 months, re-injury rate was reduced by 51%. So every month after 6 months, re-injury rate was cut in half. So from 6 to 7, half is likely to re-tear an ACL. From 7 to 8, half is likely to re-tear an ACL. 8 to 9, half as likely as to re-tear an ACL. So with these numbers, it's kind of astonishing that you would see surgeons or physical therapists or strength coaches or coaches trying to get athletes to return to sport sooner than 9 months. There's been a lot of studies, and it looks closer probably to, if you're not getting paid to play your sport, you should probably wait 12 months. But for sure, I don't want anyone that I train going back to sport in under 9 months. It's kind of bare minimum. You have a lot of other boxes to check, and we'll talk about that in a second, but bare minimum of 9 months. And I'll show this information to every athlete that I work with on return to sport, because it's one of those things. Sometimes you got to hold the athlete back a little bit. I'm chomping at the bit. I feel good. It's 6 months. Doctor said I'm ready. It's 6 months. That's their protocol. It's 6 months you can return. This specific doctor or that specific doctor, they kind of all have different protocols based on what information they've looked at, what research they've looked at, and things like that. But I'll give them this and say, look, I'm not trying to obviously not override your doctor or surgeon or athletic trainer, anybody like this. I'm just giving you this raw data. You do with it what you want. To me, this is kind of night and day, pretty clear that you shouldn't be going back for another 3 months at minimum. So within that, some of the reasons of this prevalent re-injury rate is going to be things like bad rehab, and then that happens. It's an unfortunate reality that not everyone can get the highest quality of care. It may not be up to the people they're working with. It may be that an athlete can't get a ride to physical therapy, or can't afford physical therapy, or goes to physical therapy but is in a really bad state of mind. They can't necessarily put their best foot forward every single day to make strides towards getting better. It's a pretty dark hole in ACL tear. So a lot of athletes take it pretty personally and taking it pretty hard because a lot of times their identity has been taken away. So it's really hard for them to see the light at the end of the tunnel because it is supposed to be 9 months to a year before they return to sport. That's a hard pill to swallow when you have to do rehab 2 weeks after you tore your ACL. You know, it's a hard to see a year out from there when you were just playing 2 weeks ago. And there's a lot of, why does this happen to me and things like that. But there's a lot of things that goes into that. So within the bad rehab, it could be they didn't get back strength in their quad, in their hamstring, in their calf, coordination from limb to limb, power deficits, symmetry being off as far as strength and power, altered mechanics. A lot of people still have a limp when they come back to sport, so they're returning to sport with a limp, which is going to cause extra strain on your leg. We're looking at other things up and down the chain that could be compromised because of these kind of deficits and these kind of altered mechanics. So we got to make sure that we're checking all those boxes that, hey, we have to make sure that our limb symmetry is better, our strength is back to normal, our power output is back to normal or better. We need to make sure that all of our mechanics look just like they did beforehand, and we're not kind of favoring or wanting to go to a certain movement strategy to kind of compensate out of having to actually use and trust your repaired limb. So into the second point, successful rehab is a must. And for me, that's going to be more objective as opposed to subjective. A lot of times in the rehab realm, there's a lot of more subjective. Hey, I think you're ready to do squats. I think you're ready to run. I think you're ready to whatever based on how you look. I try to get it to more hard data. And with me, I basically come in after physical therapy. So usually I don't see athletes after ACL repair. I see them 3 months after, as opposed to immediately after. The physical therapist takes them from 0 to 3 months, and I usually take them from 3 until into return to sport, and then a lot of times after continuously moving forward. But on my end, from 3 months to let's call it 9 months of return to sport, I kind of have a protocol set up to where, hey, you have to have this limb symmetry on this specific test at 20%. You can't have more than a 20% deficit. Once you get under 20% deficit, we'll move to the next phase. In the next phase, that allows you to kind of move into the next phase of rehab, which might be a little more intensity, a little different variables, different methods used, and then we'll kind of have 4 steps into that. So with each one, there's hard data, hard numbers. Hey, now that you have this done, now that you're at 20%, you're at 15%, you're at 10%, we can now move along the rehab spectrum into more higher intensity training protocols. And then the last stage is essentially training. You know, it looks like good strength and conditioning, preparing your athlete for their season. The only difference is we are still having to deal with some symptoms and things like that, of whether it be mental or physical, dealing with symptoms of leftover anxiety or leftover swelling. There's still a lot of times that when you move into the next phase, there can be a lot of volume changes. So we got to take care of the athletes and make sure that they are able to be successful at what they're doing, and what they're doing today isn't going to affect what they're able to do tomorrow on holding them back. So everything I look at is objective versus subjective, and then performance versus time. So I'm looking at objective hard data, and not, hey, at 6 months, you can run, or you can squat, or you can change your direction. It is, you have this level of strength, your RSI score is at this level, is at a percentage of the opposite limb. Okay, now you're good to run. Now that you have the baseline level of strength, baseline level of elasticity, now we can start moving forward with trying to move your rehab in the direction we're looking to go, and not just, hey, you're at 6 months. Okay, cool. Let's go run. Or you're at 9 months. Hey, let's go play sport. Now, if you're not checking the boxes performance-wise, then time doesn't mean anything. Okay, there are situations where time matters, and that's probably more from the 0 to 3 month mark. where you're looking more at like acute trauma and things like that. Your body just needs time to heal. But once you get past that, time is going to be less important and more towards passing these kind of criterion-based tests that we're looking for to move your rehab forward and to move you into return to sport. And the last thing I wanted to talk about is going to be that reintegration back into sport must be gradual. This is a very hard thing to nail down because it is more on the subjective side than objective, because it's going to be completely based on the person in front of you. You can't say, hey, you need to do 30 minutes today, an hour tomorrow, an hour and a half the next day, and then move it forward like that. It's going to be, okay, we're going to start with, you need to do, if it's football, for example, you need to do 3 periods of practice. It's going to be the first 3, and we're going to do Indy because we know it's lower level, and then we're going to get you out. Then you're going to be on the side working more recovery protocols. And then next week, we're going to start adding in period 4, 5, and 6. And we know that involves a little bit more change of direction. We know that involves a little bit more reactivity. And now we're going to see how your knee reacts. So it's going to be completely based on the person in front of you, based on their needs and their abilities, their strengths and weaknesses, and then also on how their body reacts. You get out there and you've been training for some of the people I have for 6 months on actual return to sport training. So we're from 3 months to 9 months. So they've been training with me for 6 months. We have manipulated the volume enough to where we are doing a lot of change of direction. And on the back end, it's a lot of, reactive change of direction, trying to get them ready to return to sport. But at the end of the day, even if we're doing 20 reactive 5-10-5 drills or some kind of reactive cut, it's still nowhere near the volume of a full 20 period practice they're going to see at the first day back in football. So within that, we have to make sure that we are taking care of them and managing the volume. Like I said at the beginning, the clearance of return to sport should be a group effort. It's going to be anywhere from the surgeon starting the process, the physical therapist, we've seen it from 0 to 3 months, the strength conditioning coach, sport coach. Everyone is going to have their say in it. On my end, a lot of the doctors I work with have a lot of faith in me and a lot of trust in me, and they'll say, like the last female that I was working with, that just got cleared. The doctor said, whenever he thinks you're ready, you're good to go. You're already good time-wise, and I think you're good strength-wise, but I want you to listen to him on when he thinks you're 100% ready to go, and then on within the return to play timeline, I want him then to pass you off to the athletic trainer, and then him and the athletic trainer are going to have conversations based on volume that you need when you go back. And then within that, then once the athletic trainer is good to go and feels comfortable with the amount of volume that they can handle and that they're ready to fully integrate back to sport, where hey, you're a normal athlete, you're an athlete, you need to do the full practice, you need to do your full workouts, you need to do your full games, you're all in, then it's then obviously 100% turned over to the coach. So there's this kind of passing along of the athlete from surgeon to athletic, or to physical therapist, to strength conditioning coach, to athletic trainer, who is kind of molding the gap between strength conditioning coach and then sport coach. So it's all about a seamless transition down the line to where there's no information missed. And if there is any gap in the chain, it usually, the only person it affects is going to be the athlete. So I've had instances where I'd send them back to sport and said, hey, you probably only need to do 30 minutes of practice every day this first week, or 30 minutes every other day this first week, whatever I thought that athlete could handle at the time, and that not get necessarily relayed from the surgeon and me to the athletic trainer and to the sport coach. So they took that kind of negatively, thinking that maybe we had kind of overstepped our bounds, when in reality, what happened is I'd been working with them and they had not. So as soon as they go back in the person they were working with tried to throw them in kind of full go, and then there was a lot of negative repercussions from that. So you have to make sure that your communication is strong within this entire gap, and this includes parents. Okay, so the parents need to be having these conversations, be involved with all these conversations as they go down the line, so that they can also be part of the communication on making sure that their kid is getting the best necessary work that they can get. They don't need to be thrown full speed back in, because we know that as strength and conditioning coaches anyways, we know that large spikes in volume usually lead to some sort of injuries or some sort of tweaks or small things, and then the small things build up, and then that's going to cause a lot of issues down the line as well. So within this last part of reintegration into sport, it's going to be a lot of holding the athlete back because they're ready. I mean, they're practicing now. Why I can practice? Why can't I play a game? Why can't I play a game right now? Why can't I play? They said I was cleared yesterday. Why can't I do a full practice today? That doesn't make sense to them. So you have to really communicate strongly on the fact that they're not necessarily, just because they are cleared the day before, they weren't cleared. So what's the difference in one day of, hey, I wasn't cleared, now I can do a full practice? Like it just, you have to use your kind of knowledge to convey to them, hey, we need to make sure that you're not going to re-injure yourself. This is a long process. In the grand scheme of things, what's another month compared to, or 3 weeks or 2 weeks compared to going in full speed and getting hurt first day and having to do a whole another year. So making sure that discussion is handled properly, and that's on the strength and conditioning coach, that's on athletic trainer, that's on the parents. Okay, there's going to be a lot of people having to hold the athlete back because they're chomping at the bit. They haven't done it in a year. We're ready to go. So as long as the volume spikes are handled, the symptoms, if they're getting any swelling within their knee, that means they're probably going in too fast, too hard. We need to pull back a little bit, give them a little time off, and then try to up our volume to where we can kind of reload it and start from the bottom and start over. If they have any tightness or anything anywhere, we got to make sure we're taking care of that so that they're not creating any other issues and within that, which may be like a contralateral tear. Say their hip gets tight and then they got kind of a hip height going on and they start limping a little bit. Now they're putting stress on their other leg, and then some little thing is going to happen and they could get re-injured. It could be knee, ankle, hip, anything. So as long as everyone's involved in the process, and then we can get the athlete back slowly reintroduced into the sport, it needs to usually probably be, I like to think, at least a 1 month process of easing them back into it. Could be longer depending on how their symptoms hold up and how their knee reacts and how their body handles the new loads. Because like I said, in the grand scheme of things, what is, if we do 20 5-10-5 drills, that's nothing compared to one full soccer practice. The cuts and the change of directions and the torque on their knee of trying to kick the ball is going to be insane compared to the volume that we've had between the weight room and field work, which we're doing everything we can, but it still doesn't mimic sport as well as sport practice. If you want to get better at your sport, you have to practice your sport. And within that, that's pretty much what I have today. I just want to make sure that everybody has a lot of information on this, because it's a topic that I care a lot about, and it's something that I really hate to see athletes get re-injured, especially when it could have possibly been avoided. You can't ever say that it could have, because stuff happens, but at the same time, if they're not necessarily taking care of everything they need to take care of, you're leaving them susceptible. So it could be an issue that could be avoided.